I'm Carl Brewer, Mayor of the City of Wichita. On behalf of the Wichita City Council and all the citizens of our community, I invite you to attend the Kansas Preservation, Energy, and Sustainability Conference and Fair, January 25th through the 28th. This year's event at Century 2 and the Drury Plaza Hotel Broadview is bigger than ever. It combines the annual Kansas Historical Society Conference with the Regional Energy and Sustainability Conference and Fair. Whether you're a homeowner, business, or nonprofit, you'll find valuable information that will help you to save money while you improve the quality of life of our community. Some of the sessions require paid registration, but the final day, Saturday, January the 28th, is free to anyone who comes downtown to Century 2. You'll learn about electric cars, home energy audits, and lots of other useful information. And you can also win valuable prizes and receive free gifts. Go to greenwichita.org for more information about the conference, and be sure to like us on Facebook. You can enter to win a bicycle in our giveaway at facebook.com/greenwichita. We'll also recognize this year's winners of the annual Air Quality Awards, which are given out to citizens and businesses who are using common sense strategies to save money and keep our air clean. In just a moment, you'll hear from some past winners who are leading the way to a clean and sustainable environment. They are proving that you can save money and save our valuable natural resources at the same time. So, mark your calendar for the last week in January and join us in downtown Wichita. The time you spend at this annual conference will pay off all year long. Remember, you have to go green to save green.
Each year, the annual Regional Energy Conference and Fair includes the Clean Air Awards, recognizing local individuals, businesses, or nonprofits who are leading the way to a clean and sustainable environment. This year's winners will be announced at the January 27th and 28th session of the 2012 conference. Now we'll take a look back at a previous winner, Via Christi Regional Medical Center, which was recognized in 2008 for a multi-year program that has saved thousands of healthcare dollars while conserving our natural resources. The story told by Via Christi is one that can serve as an inspiration for the entire community. Listen as Via Christi explains how stewardship, commitment, and fiscal responsibility guide their long-term strategy.
Via Christi Health is an organization of 10,000 employees throughout Kansas and part of Oklahoma. We include 5 acute care hospitals just in Wichita, which we serve, the population in greater Wichita. We also have senior villages, and we have hospitals in Manhattan, Pittsburgh, as well as we're managing a McPherson Hospital now. So all of those encompass what Via Christi Health represents. We have a mission given to us by our founding orders, the Sisters of St. Joseph and the Sisters of Sorrowful Mother, which founded us and became Via Christi Health in 1995. As a part of that, our core value today of stewardship, where we're entrusted to responsibly care for the resources entrusted to us, is again one of our core values, and that has brought this whole emphasis to stewardship of our resources, meaning the use resources such as energy and the resources such as not wasting resources in landfills and things like that. Well, stewardship for us, means a variety of things. Obviously, one, the financial end of it, which is those resources entrusted to us to make sure we can continue this mission and keep it going for eternity, basically. But the stewardship of our resources, such as goes as far as using LEED principles in the things we build, LEED being the leadership in environmental design. If we're talking about leadership of environmental efficient design and the construction of everything we do, we use those principles. But as far as like resources and energy, gas, electricity, all of those things, we have put in place things to conserve on the use of those. Again, which translates into utilizing those resources, meaning our money is saved in that regard too. Then there's the whole area of recycling. and reducing the waste we actually create. For example, we don't want to pollute the environment any more than is absolutely necessary with our waste, so we reduce the amount of toxic chemicals we create. In our business of pharmaceuticals, there's a lot of very hazardous materials that come out of that, so we look all the time in methods to reduce how much of that we utilize or how much of that we actually waste. The project that we achieved the award in 2008 was actually a project that was started by a relationship we have that doesn't talk to it in the award with K-State, where we will hire an intern here as part of our team, and they will look for projects in which we can save resources, either, like I said, electrical, gas, or waste reduction, because it all goes towards saving the environment one way or another, because you're not burning coal to create electricity, you're not wasting gas when you burn, or the pollution of our landfills, or burning those things also to get rid of them. So all of those things were part of a project that we developed with a K-State intern at the time. So they helped us analyze the cost relationship and the whole idea of, this is not something that just started in that 2008 timeframe, or even 2007 when the whole thing started kicking off. This has been something of our heritage. I mean, this is not something new, but getting the resources in place to be able to analyze it, and these relationships we've built with K-State, for example, to have this kind of a program at Via Christi. At Via Christi, we have a really strong team, and I would believe that when we started this project, there was a lot of data in the industry and a lot of data that supported this that wasn't a mystery or wasn't a gamble. It was pretty well thought out, and there's a lot of data throughout the industry to support this kind of activity. It's more of how much you engage it, and there's a belief, again, outside in the community that maybe it really won't work as much. But when you start doing this stuff, your employees engage in this. They jump on board because they want to be part of that. They do it at home, or there are those people that are environmentally conscious today, and they come to work and say, well, we're wasting here, or we're wasting there. Can you help us not waste? Because we understand one of our core values being stewardship. So they jump on board a lot faster than you even imagine. The idea of going green sometimes costs money. And implementing things like an energy program, you might have to build something or install something that is more efficient than the last thing you were using. An example that might be a light switch that is a sensor light switch that knows when an occupant comes into the building or into the space, and the lights come on and they go off when they're not there. Well, that's a much more expensive device than the normal switch that you turn on and off. So we have to analyze the cost benefit of that savings before we go and install it, and what's the payback. Maybe it's 2 years, maybe it's 5 years. So we analyze each of those things to be accountable for that that resource we're spending in order to install it. And there's many things we have developed in the last 5 years since this our program started, since I've been here anyway, where we've had to analyze that and do a lot of big projects, sometimes costing millions of dollars over the long haul to install it, but the savings far exceed that over the time period that we put it in. Healthcare in general, due to its the changing environment we're working every day with, reduced reimbursement, there is absolutely an obligation on the side of facilities, if you will, my responsibilities, to be far more conscious about those kind of costs than in the past. Back in the early 80s and up to the 90s, there was a lot bigger push towards some of these things because there were federal grants and things like that, because we were in an energy situation back then. Well, when that went away, a lot of that stuff kind of waned. But the emphasis now on us reducing costs and being way more cost conscious than we were in the past. So there is absolutely a big obligation for healthcare, I would say throughout the country, much less just in Wichita, but to be conscious about those costs and be very much more competitive with our not as competitive with our competition, but just with the cost of healthcare. And when talking about the impact to the patient cost, our whole environment today is driving those costs down and the reimbursement amount. So yes, our patients would see it in the result of what they're paying for healthcare services, and that is our driving criteria today to get towards this, because we have to deliver care less costly, and that does impact what our patients see in their bill or are their payers. They're driving us in that direction as well, because they aren't paying us as much as they used to pay. So we have to react to that as well. The resource issue that I talked about of having to justify any kind of expenditures in order to make things happen in this regard, we have an ongoing program that we will continue from this 2008 award that we won. Each year we have won other awards as well, from water quality to the things around the energy area. We continue this with K-State. We continue to get interns and look at every opportunity we can to either reduce costs one way or another, or enhance our environment through these various opportunities. So we will continue this as an ongoing project that we will always be looking at ways to improve the way we utilize our resources. I think we have taken a lot of the low-hanging fruit kind of out of our operations, the big stuff right away, because that was the things that have the quickest payback. But I think there's still a lot of opportunity because we just don't have all of the resources that I wish I had to just spend and make it the best and most efficient, because it really doesn't pay back as quickly as we can. And we have other demands on our resources, such as medical equipment and staffing for our patients. So we have to balance that, and that really is what we do each year. But I think there are still opportunities, pretty good ones. I mean, it isn't just little stuff that's still left to do. It's just finding the resources, being able to expend it at those things.
So in 2007, I came on board with Via Christi, and we determined through an analysis that our energy cost was higher than industry standards. At the same time, K-State contacted us and asked us to become a partner with them, so they provided us an intern. Through that work, many initiatives were identified that we ended up acting upon. Art and I then sat down and put a plan together to create a long-term program. In order to sustain the program, we presented a position called Energy Manager, which was hired in 2008. The Energy Manager created and maintains the sustainable program. Basically, if you think of it as a circle, you got to have an idea. What are you going to do that's going to save energy? Okay, so in order to you come up with the idea, then you got to come up with, do you think it's a viable idea? You got to analyze it. So they analyze it, then it goes into the program. It's got to be implemented. Then you got to measure it long term to track your progress. At the same time, you're creating new ideas. So basically, you're dumping ideas in the bucket, you're analyzing the ideas, you're implementing the ideas, you're tracking the ideas, you're creating new ideas. So it's just this vicious circle that you want to try to create. That's what the Energy Manager does. That's one of the reasons why I firmly believe this program has been as successful as it has. She came up with different ideas and initiatives: lighting retrofits, dimmer switches, water aerators, coil replacements, which are a lot more in depth. You look at this, so an example to determine if something's low-hanging fruit versus something that's going to cost you a lot more on capital dollars. The return on investment would be to count the number of fixtures you have in your facility, multiply that times the cost of the aerator and the rough approximated time to install the aerator, do the math, and then you determine what you would save by gallons per minute. Do the math there, and you can kind of tell what your cost-benefit analysis will be. We have ongoing construction. So we've decided to implement LEED principles without going after the certifications, and that's been a function of having that Energy Manager, so that what you're not doing is retrofitting part of your facility and then building the new part in unwise ways that do not consider energy management as are in the forefront. In the past, energy consumption and reduction was not a big concern for facility managers because the cost of energy was not on the rise that it is today. So the demand for energy and the cost for energy has taken on a whole new profile in society. So we've been forced to look at it for sustainability. A larger portion of our operating budget are being taken up every year by the cost of energy. In order to move forward and transition from your low-hanging fruit to your higher cost items, what you really need to do is an in-depth analysis. In some cases, we use professional engineers, mechanical engineers, electrical engineers to take an idea, break it down, determine what the cost benefit would be compared to the capital dollars. We'll actually create design drawings in some cases. So an example here on the St. Francis campus, we installed a fairly expensive stack economizer, which basically allows your boiler to operate in a more efficient manner. The way we decided to do that was through the help with outside engineers. Came up with an approximate cost savings of $200,000 per year, presented it to the executive team, they bought off on it, and we've completed the project. When you consider the parameters of when something's a good idea or not, I'm going to take you back to the low-hanging fruit piece. Early on, almost everything you look at make sense to do, because you spend a few $1,000s and then you pay for it within that first year. After that, though, what happens is you start looking at a year payback or 2-year payback or 5-year payback or 10-year payback. At some point, it becomes about, is it the money, the consumption, or is it just the right thing to do? And so those are all discussions. There's not one particular formula that you use, but you always look at how much you're going to invest, how long it's going to take you to pay it back. And then as an organization, it depends on where you are financially as to which direction you choose. When Art and I sat down and started planning out the energy management strategy, we wanted accountability. We came up with 3 variables that we thought if we could show constant progress on, it would sell this program and keep it sustainable. One variable was cost per square foot, another variable was cost in dollars terms, and another variable was consumption. So everything we do when we perform the payback analysis or the quarterly or annual look back at how things are going are based on those 3 variables that we present to the executive team, and we monitor our progress. Are we doing well, or are we not doing well? In order to determine whether we were successful or not, I mentioned before the benchmarks that we use. In 2007, it was our baseline. In 2008, we actually had an increase in consumption of 2.23%, which translated into a $250,000 increase in utility cost. Now, this was prior to actually implementing any of the ideas. In 2009, we actually had a 3% decrease in consumption, coupled with a $450,000 increase in cost. So that illustrates the point that you cannot control dollars. You can only control consumption. In 2009, if you remember, the cost of oil was shooting through the roof. So even with the consumption reduction, we suffered the cost increase. The big point there is what would have happened had we not had the 3% consumption reduction. In 2010, we realized a 4% consumption reduction, which did translate into a $500,000 decrease in dollars spent on energy. And in 2011, we're still doing the reconciliation, but we anticipate it to be a 4% decrease, which should come in around $450,000, $500,000 decrease in consumption. One of our other benchmarks was the we started off measuring $4 per square foot. Our goal is $2.28 per square foot. What you do is you say, okay, how much square footage do we have? What do we spend completely on energy? Divide it, you get a number per square foot. Okay, so industry standard should be $2.30 per square foot. Now, this doesn't factor in inflation. So that's our goal. We want to be industry standard. Where we're at when we started this program was $4 a square foot. So where we're at now, we're down around $3.20, $3.30 a square foot. So we're making great headway. There is a difference in trying to perform energy management functions in healthcare versus other business settings. Healthcare industries have air exchanges and temperature requirements and humidity requirements. For example, in your surgery suites or in your patient room suites that are not, they don't transfer over into your typical business environment. You got different fresh air requirements which magnify and make the whole equation much more complex. If an organization is in a position where they don't have capital dollars available, there's other resources that they can look at. There's companies that will do performance management contracts. So you can go to Johnson Controls, Siemens, Trane, bring them in, and they'll actually sit down with you and they'll say they'll finance your energy conservation methods. What you're doing, though, you're dancing with the devil a little bit, because they're going to take a portion of your savings. But sometimes, hey, a portion of the savings is better than no savings at all. And if you're backed into a corner, you don't have the capital dollars, you can go that route. Yes, Via Christie's thankfully not in that position.
Our recycling and waste reduction effort started out with a group of us coming together and deciding to form a green team. And we did this out of a sense of social responsibility. We saw how much waste was being taken out of the hospital every single day and picked up and taken off. And so we decided that there were a lot of opportunities, and the way to get things done here is to form a team and start working together as a group. And that's exactly what we did. And we had this, we called ourselves the Via Christi Green Team. Very enthusiastic group of people. It was people that volunteered their times. They worked in different vocations across the Via Christi. We had people from nutrition services, clinical staff, pharmacy. A whole group of us came together. One of our first things that we decided to do was to put a program in place that would enable our staff to collect the recyclables in their departments and then take them someplace. So we got with Waste Connections, who hauls off our trash every single day here, and we said to them, we need a recycling container. And we're a committee that is budget neutral, which means we don't have any money to operate with. So could you please just give us a recycling container? And they did. And the good part for them is they get to keep everything in it and make money off of it, hopefully. But they provide us with recycling containers, the great big huge ones, at both of our main hospital containers. And then we put the word out to our staff and we said, can you please pick up the recyclables from your areas and take them out to this container? And then we just kind of sat back and watched, and the results were amazing. This last year, Via Christi eliminated 120,000 pounds of waste from the landfill, just from our staff voluntarily taking their recyclables and from their departments. And we also told them, if you don't have this program out where you live, because we have staff that drive in from all over the place, bring your recyclables from home. Our intent was just to reduce our footprint. And so that was one of the major successes that our little team has had. Originally, it was, we'll come pick up the dumpster whenever you call us. And we were calling them like every 2 weeks. Now, they're coming 3 times a week to pick up the dumpsters. They are that full. But we had a lot of support from our administration. One of our senior vice presidents is Sister Sherry Marie, and she supported it wholeheartedly from the very get-go. And I have support from like our VP of facilities, who has been very supportive. And so there definitely was not a lack of support. There was a lot of encouragement when they found out that we were doing this to move forward with it. We have a program here called the reusable sharps containers. Our sharps containers are a red plastic 2-gallon containers. There's one in every patient room, and they're in the med rooms. They're where you put your disposed of sharps in it, the needles, the syringes, that type of thing. Anything that's sharp that's been used for patient care goes in those bins. Previously, we would fill the containers up 2/3 full. We would pick them up. They would go to a treatment facility where they would be ground up, the container and the sharps, and then go to a landfill after it was autoclaved. We connected with a company who is providing reusable sharps containers. They bring the containers in, put them up. After they're filled 1/2 to 2/3 full, they take them down. They go to a treatment facility where they go through this robot type of environment where the top is popped off. The sharps are eliminated out of there. They're ground up and disposed of, but the containers are inspected, disinfected, washed, dried, and brought back. And by reusing the sharps containers, Via Christi has eliminated 60,000 pounds of plastic from landfills just this last year, just in 2011. It's turned out to be budget neutral. We're not paying for all those new containers, but we are paying for this added service. We're more than happy to do that. It's a wash, money-wise, and it's a huge plus for the environment to eliminate that plastic. And then we have other programs in place here. We have a program in place to recycle our used medical equipment. After our biomedical, people have determined that there's no patient information on it, then that it's safe to be disposed of. We send it to a recycling facility. We also dispose of all of our cardboard in a recycling container. We separate that out. All of our confidential paperwork is collected in big blue bins on site here. We have a company that comes here. The bins go out to their truck where the contents are dumped and shredded before they ever leave our site. And then the shredded paper is taken and reused and recycled into more paper. So all of our patient confidentiality paperwork is saved and recycled that way. Another program that we put in place was recycling our metal containers. We have empty shelves that we throw away. We have empty food carts that we throw away. They're made out of metal. They're worth something. So we got with Gleckman Metal here in Wichita. They provide us with a dumpster. We put it in there. They come and pick it up. When it's full, they pay us the market value for the metal, which goes to our foundation. So that is, once again, waste that's eliminated from the landfill. We recently have a compactor here that we use for wood products. We go through a lot of pallets. A lot of freight comes in on pallets. That wood is now put in a dumpster that the wood is recycled. We're ready to start a hospital-wide recycling program where we're putting the recycling containers in place, and our environmental services staff who are coming in to pick up the trash and take it out, or they're going to pick up the trash and the recyclables and take it out and then separate it out. So it has grown from people coming into the departments just kind of doing it on their own, a little more sporadic, to a more organized approach to recycling. And we have some really ambitious goals. We want to reduce our taking in our total waste that we could have here. We want to separate 70% of that out into recycling or waste reduction over the next 3 years. So we have a very ambitious plan in place to continue to dramatically reduce our footprint. Well, I'd say the support is definitely there from just watching our staff being willing to pick up recyclables from their departments and walk out across the parking lot over to the recycling container instead of just throwing it in the trash, which would be the easy thing to do. So the passion and the commitment is there. Just the wherewithal to do it is what we've provided our staff, and I think if the same thing was provided for our community, you would see the same results. We're heavily involved with Green Biz Wichita, and we also are involved with WIRE. It's led by the KU, Dr. Ablaw, and it's a Wichita initiative to renew the environment, and we're also involved with that group. So we see our place in the community is very important, and so we participate with our community in those type of endeavors as well. What I've learned is, we spend way too much money on having our trash hauled off. I get to sign the trash invoices myself, and we're spending a ridiculous amount to get our trash hauled out, which means we're hauling out way too much. If we could meet our goal by diverting 70% into recycling, it's going to help the bottom line. There's just no two ways about it.